Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe how to reduce medication error. A medication error is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of healthcare professional, patient or consumer. Serious harmful results of medication errors may include death, life-threatening situation, hospitalization, disability, birth defect. Causes of medication errors: expired product, incorrect duration, incorrect preparation, incorrect strength, incorrect infusion rate, incorrect timing, incorrect dose, and incorrect dosage form. Medication error risk factors: due to high volume, poor handwriting, inexperienced staff, lack of follow-up, lack of appropriate monitoring, medication requiring calculations, poor communications, verbal orders. Consumer play an important role in reducing medication errors. Find out what drugs you are taking and what is it for. Be sure to ask the same of drug and the purpose of the drug. Find out how to take the drug and make sure you understand the direction. Ask if the medicine needs to be kept in refrigerator. Check the container label every time you take a drug. This is especially important if you are taking several drugs because it will lower your risk of accidentally taking the wrong medicine. Keep drugs stored in their original containers. Many pills look alike, so keep them in their original container will help the name of drug and how to take them. If you are having trouble keeping multiple medications straight, ask your doctor or pharmacist about helpful aids. Be aware of the risk of drug and drug-food interaction. If in doubt, you have question about your medication, ask your pharmacist or other healthcare providers. Thank you for watching Daily Drug Info.